All right, here we are, another afternoon of coronavirus inside the Arizona numbers, where we take a deeper dive into the numbers the state puts out to help you better understand, make the best choices for your family and your life. So we want to dive right into the numbers, and also in the comment section, feel free to ask us a question about the data, and we'll help you find the exact number that you're looking for. I'm Katie Rammel, alongside me, Garrett Archer here. I'm here at the ABC 15 studio today, Garrett. As you can see, it is wildly empty. So Garrett, your desk is actually over this way. I'm taking good care of it while you're not here. We want to dive into the numbers. The summary page was pretty much what we thought it would be today. Pretty surprising, because we knew it would be a big number after those low numbers came out over the weekend. So as we've mentioned in some of these chats in the past, it's worth taking a look at this from a broader perspective, not just breaking it down by day. So we're hoping to help you do that here today. So Garrett, on the summary page today, I think that the big thing everybody was looking at, and for those of you just joining in, we're talking about the Arizona Department of Health website. The data dashboard has a broad summary page where you get the latest updates each morning. And I think that the number of deaths, Garrett, was probably the most alarming thing people saw there today.
Yeah, so the AZDHS reported 117 deaths on today's report. That is by far the highest number reported on any 24-hour reporting. Now, of course, to put that into perspective, two things to consider. The AZDHS also put out information this morning saying that a portion of these deaths came from what's called certificate surveillance. So they actually took the information, like the social security number, the names, the private information, and then matched it to hospitals or mortuary morgues and whatnot, and picked up deaths that they had otherwise missed previously. And that what they said, that was about 52 of those. And then also to consider, of course, we are coming off of a 3-day holiday weekend. And as we talked about before, we had very, very low death numbers in the last couple days. And we were sort of expecting this number to fill in the days we were missing on Saturday, Sunday, and Monday.
Yeah, it was one of the things we had warned over the weekend is don't be too confident in these low numbers and make choices about your life that maybe has you heading out or taking more risks, because we knew that they would pop up again on this day, on this Tuesday. So let's dive into that certificate matching. Normally, this can go back to March, April, months back. In this case, these death certificates that were matched did not go back as far.
No, they did not. In fact, I'll show you the epi curve that I put together on a regular basis on this. And in fact, that was one of the things that we sort of heard from the AZDHS, is that they were going to be said that because of certificate matching, we'd be seeing sort of numbers going back. But what you're seeing right here in the light blue are numbers that were added today. And then the dark blue were numbers that were already placed on that day. And as you can see, upwards to 90% of all of the data that was added, even with the certificate match, was added in the last about 14 days. And that's sort of where we would expect to see numbers being added. So this was, even though with the certificate match, it was still, for the most part, a recent addition to the deaths. You can see peppered along here, you see some deaths added in the back in May and even in April. But for the most part, the numbers are sizably larger right here on this side of the curve, and it's caused an increase in the 7-day moving average.
So I want to dive right into the questions. We're getting a lot of them right away. Mike Corbin asks about death certificate matching, what that is exactly. Mike might have joined us just a minute too late. Can you describe what that is again, and how they go back and take part in this process? And Mike, there's also, if you want to read even more, a full blog on the Arizona Department of Health Services website right now that sort of explains how all this happens as well. But in short.
So what they do this with hospitalizations and deaths for the most part, because those two, of all the things that the AZDHS does, those two are the most investigative. They actually have people that are on staff that are trying to fill in these curves. And this data, when, obviously because it's investigative, it requires human manpower. Every once in a while, they will go back through They will do a match with hospital systems, with mortuaries, with other places that are connected to the healthcare, sort of the back end reporting system, and they will provide sort of the data that they have and say, we have this social security number, we have this, we have this, we have this case number. What do you have anything on a status of that case? And they'll come back, you know, in this case, they come back as these are deceased patients or deceased people, and they come back and they fill in the curve.
So three colors that you're looking at here on his graph, the darker blue, the deaths that we've already accounted for. The lighter blue are the ones that he's gone and filled back in. Just within the last 24 hours is the light blue. Those are just the days,
last
right?
24 hours. In fact, I'm going to stop sharing this really quick and go to another tab that's going to show sort of, let me just make sure I have the right one. Yes,
and then,
the right one.
Yeah,
so,
go for it. And then Mike, to answer Mike's question, and then that yellow line that you're looking at is sort of, that is the curve, that is the smoothed out line. So you can kind of get a better understanding of where things are, not ride that roller coaster of each day could be high and low. This is going to give you a more softened curve so that you can see the actual trends that are happening there.
So the graph that I have ready to go here, this is actually sort of an interactive combination of both the epi chart, which is this one, as well as the reported numbers of the AZDHS. And so what you're looking right here is what this is the date of death. In fact, this one is, hold on a second, I may have to refresh this.
That's fine. As you're refreshing, I'm going to point out to him as well that those dips that you see every couple days, those would be the weekends. So
yeah, so this is what we got from the AZDHS on a daily basis. So you can see 110 here, or the 117 here. You see it's coming off of some very low reporting days. You see every week so far we've had one day in which basically you can see that the AZDHS and the counties are filling in numbers from very low days, because for the most part our numbers are staying within this sort of 40, 35, 40 line. And this is, again, this is what we see on the reporting. But then when we go to date of death, you see this is actually what it looks like when they actually fill it into the date of occurrence. And this is where you're seeing these large light blue numbers. And you can see, just based on this, how long it takes for the data to sort of stabilize. It takes till about June 21st, June 20th, for you know, now you're at a point where the light blue is no longer making up a significant portion of additions to the curve.
Yeah, so often in this day and age, everybody wants things instantly, and that's just not how the data flows through this in this case. We're getting so many good questions, and I want to get to them. Christoph is asking, where is that MIT chart? I think, Christoph, you're asking about the MIT guys graph that we shared with you a couple days ago. So we can pull that up and share that once again. There's so many really interesting and really helpful graphs and different ways to look at these numbers that help people better digest all of this and better understand all of it. Do you have that graph handy, Garrett?
I do. It's the URL is covid19-projections.com, and it's right here. This is what the main page looks like, covid19-projections.com. You'll see on our screen here, it says USAZ. That's how you get to Arizona. That's US-AZ right here. And this is what this is the projection model that is the one that I prefer, because it's a machine learning model. And it's sort of showing where it thinks things are right now. Right now it has us assigned an R0 of 1.06. And then you see it assumes that we're going to be reaching a peak anywhere between July 21st to August 4th is sort of where they think the peak numbers are going to start showing up. We
will leave that address up there for just another second so that, Christoph, you can be sure to write that down. I always mention this. One of the things I do is just save these websites in my toolbar at the top so that you can click through them and check everything out. So that is a great site. You know, I just learned from a coworker that the R0 site that we were talking about yesterday was actually created by the Instagram guys. The guys who created Instagram.
Oh,
the ones
that's
who are
interesting.
live together. So that was fascinating, because I said, I know exactly of this site. We've talked about this before. And for those of you that were interested in looking at that site, it is rt.live/US/AZ. So that will give you a closer look at one of the numbers our governor here in Arizona is watching so closely. It looked like today's, when I checked it, was at 1.09.
Yeah, you'll see some variation with the models, and that's why, like I said, the Yu Yang Gu model, the MIT model, that one says 1.06. This is 1.09. You know, it's a 300th of a point difference. Of course, in epidemiology, that means a lot, but you know, you'll see some variation in what the estimates are, because of course these are estimates, no matter.
So I know a lot of people had only heard of that for the first time. It's basically, if it's above a 1.0, it means that COVID-19 is spreading quickly. If it's below 1.0, that's when we'll be able to see infection slow. Yes. I forget what number the governor said he would feel comfortable with. I don't know if it was 1.0. He did mention a specific number in his news conference last week, but that's one of the things he's watching very closely. And this part of the chart, Garrett, if you go back up, I know that this is broken down by state, but then you can see sort of where we rank within the states. I think we were like,
we should be. Yep. See, these are all 1.4. We are right here, right in the middle, at 1.09. So you can see there are several states that are estimated to have a higher RT at this point.
Yeah, so if you'd like to check that out, that's where you can see that on that website as well. One more question we just got in from Cassie. Cassie's asking about the number of recovered, and we go over this every day, but I think it's important because so many people ask this question. Cassie, there is no agreed upon definition for recoveries. So what is a recovery for me might be different than a recovery for Garrett or a recovery for you or your family. The best number that we have at this point is being released from the hospital. So we do have those numbers. I checked it this morning, and you can check it on covidtracking.com. This morning for Arizona, it was at 11,836. But that is the best number that we have so far, just because people get sick with this and end up being sick for so long. Those who have symptoms can have them for 2 weeks or several months. So there's no agreed upon definition of when, okay, I'm healthy again. Is healthy defined by out of the hospital? Is it defined by I'm 100%, I feel back to normal? Whatever that is for you or for me might be different until everybody can agree on what that definition is. That's the best number we can pass along to you. And that's the website where you can find it. So Cassie, good question.
And I see someone asked here, Candace asked, how come Texas can give that number? And so the answer to that, of course, is that their health department has decided or settled on a definition of recovery. Our health department here has not settled on a definition of recovery. And so we can only use the numbers we have as a proxy, which are hospital discharges. We're waiting for the health department to come up with something, but until that time, we don't have anything, because we're not going to sort of make one up out of thin air. And so Texas has decided on what they define as recoveries. In fact, we have several counties that have actually decided on what a recovery number is. We actually have several counties that are Coconino posts a recovery number. The Navajo Nation is posting a recovery number. So we have several counties that are posting recoveries, and in most cases, the difference is about 50%. So about 50% of the cases that they are reporting are active cases, and the remainder are recoveries. So, but that's of course, that's not, we're not going to post that as a recovery number, especially because Maricopa is not one of those counties. Without Pima and Maricopa as being one of the counties that post a recovery number, our recovery number would be extremely small if we rely on the county health definitions, because that's Pima and Maricopa are 80-something% of the state.
Yeah. Mario, thank you. We see your comment there. Great reporting and information sharing. That's what we hope to do, is we hope to give you the information, help you find the tools so that you can go dive into the numbers, and then you make the best choices for your family. We're not here to make the choices for you. We're here to show you where the information is so that you're able to find it. We're on these websites every single day, and we just thought it would be easier to teach you where to find these things so you can go dive into the numbers. You can look at your home state if you're thinking of traveling there, whatever that means for you, whatever that definition is for you. Scott Noseworthy writes, what is the recovery rate percentage? Well, the only way we would be able to figure that, Scott, is if we take that 11,000 and then divide that into the positive number of tests. That's the only way I can think of getting close to a percentage rate. Is that what you're thinking, Garrett?
Yeah, I would like using the discharge. I think what the CDC is sort of pushing on right now, and again, we're waiting for the ACDHS to adopt this. But depending on the age category, like for people under the age of 45, the recovery definition would be something like 2 weeks. For people over 45, it would probably be closer to a month. And of course, these are always estimates, but that's sort of how I see the CDC and maybe the ACDHS finally coming to an agreement on a recovery number, is saying, okay, if you're under a certain age, we will count your cases recovered after 14 days. If you're over a certain age, we're going to count it after 27 days.
Right. One other question coming up, and I know we can show Tony where to find this. Tony is asking about ethnicity and age. Tony, if you're still on here, let us know if you're in Maricopa County, because that's going to give you a bigger breakdown, and we'll show you that website. Actually, we could show you that first. Let's just assume he's in Maricopa County, and if we hear otherwise, we can help him dive into that number somewhere else. There is a complete breakdown on all of that for you, where you can split it into age group. If you go to the Maricopa County's website, it's got tabs at the top that divide it by age groups and also race and ethnicity. So you'll be able to peek at those numbers a little bit more and see some of the breakdowns. Garrett, are you able to read us what some of those sort of headlines that Maricopa County's put on there for us?
Yeah, so what they do is, in order to sort of standardize this data, they'll take it and they put it into what's called a per capita, which is the rate per 100,000 persons. So what you're seeing here is the case rate for Asian or Pacific Islander is about 343, white 557, and then Black African American 795, and then Native American, which we know was very hard hit in the tribal areas. They have an extremely high case rate even in Maricopa County at 2370. So this is basically, you're saying, instead of, like, obviously if we just looked at these numbers by the raw number of ethnicity, there's a much better chance that white, and then I don't see Hispanic on here, but Hispanic, there's a checkbox, sorry, right there. And this will show you ethnicity. And these are all defined by the census, by the way. Census defines Hispanic as an ethnicity, and then the others were the race definitions on Hispanic. And so you can see right here, Hispanic or Latino ethnicities have a higher hospitalization rate, but a much higher COVID-19 case rate than not Hispanic or Latino. And then you can see them here as well.
So I hope that helps answer his question. I don't see if he's replied what county he's in, but that's the place I go. And then Garrett, can you click on the age groups tab there to show him how that kind of breaks down? And you can see everything by age group. You can see who's been hospitalized, the death numbers in there, and also ICU. So hopefully that helps to answer his question on where to find that. I'm checking the comments really quick just to see if he's messaged us back. But that is where I would go for the most accurate numbers for our county.
Sorry, Debbie Kirkpatrick writes, what is this? This is Maricopa County's dashboard. So if you Google Maricopa County COVID-19, this will be what comes up.
Yeah, Debbie, also let us know if you're not in Maricopa County, and we'll help you find other information. But that's got some really easy graphs that you can see updated each day, so you'll be able to track that. Wayne Childs asks, what percentage of the ICU population is COVID in AZ? We can see that breakdown on the hospitalizations page, can't we, for him, Garrett?
Yes, we can.
It'll take just a minute to get to it. So Wayne, stay with us as Garrett pulls that up. I want to update some of you on a couple of news headlines that have come in this afternoon. If you've been watching on Facebook Live here, one of the Facebook Lives that was just before us was a news conference with Mountainside Fitness. They are going to shut down at 2 o'clock. I have no idea. Oh, it's 2 o'clock right now. They're shutting down in 3 minutes after a judge has denied their temporary restraining order. Their request came in. It was against Governor Ducey. It was in connection to the executive order that said all the gyms and movie theaters and water parks had to close down. Mountainside Fitness fought it. They lost. They're closing in a few minutes, and they'll be closed at least until July 27th. And of course, we will have a complete breakdown of all of that for you on our news tonight at 5, 6, 4, 5, 6, and 10. So we want to keep you updated on some of the news headlines as well. Were you able to pull that up for Wayne, Garrett?
Yes, I do have that. So what this is so the AZDHS does have this data, but I've taken this and put it all together so that it's easier to see Because if you look at the data dashboard from the AZDHS, what you would see is the total census, which is the number of ICU beds that are occupied and then not occupied, and then another chart will show you the number of ICU patients. So what I did was I simply put those two graphs together. So what you can see here, right now, this color is the COVID patients, and they're about 52% of the total occupied ICU, or excuse me, total ICU beds are from COVID patients at this moment. And of course, this is just to understand, this is positive and suspected COVID patients, and you know how each hospital defines those.
A couple of people have asked, thank you, Garrett. A couple of people are asking where we would find numbers for Pinellas County. Jody just asked that, and also Davy. So for Jody and for Davy, we're able to pull those numbers up for them, aren't we?
Yes. Now, Pinellas County does not right now. It currently does not independently report outside of the AZDHS, but you can find it on the AZDHS. So if you go to the summary page, you can click on any of these counties on the summary page, and it will change all of the numbers.
Yeah.
It should. It just takes a while.
Okay. That's a helpful way, similar to what we see in the zip codes, but that breaks it all down by county and gives you
a
better idea.
You can see what we did today. Yeah, 3 new deaths in Pinellas County, 81 total for the county, 192 cases today. And you can also do this for hospitalizations, which is right here. You can also check what their curve looks like and what their numbers look like. Sometimes we'll see. Nope, it looks like it's not going to allow us to. Sometimes the AZDHS disables the ability for the data to change. So sadly, with the counties, we don't have a lot of information on hospital beds. We don't have this by county. These are all statewide level data. I cannot produce this by county. I cannot produce this by county. This is all just hospital reporting systems put in. So this is just the limitations of the reporting we have.
So just to, Davey says, thank you, by the way, and I just want to refresh for both Jody and Davey. We're on the Arizona Department of Health website. You can go to the summary page and then go to click down to your particular county. So that works for anywhere across Arizona. So it's a simple way to check that if you're in a different area than you feel is getting enough attention to get you the numbers and find you that information. Brianne writes, is the information as of today? It is, isn't it?
Yes. Well, it's technically as of yesterday. Just to be completely honest, they do these things at they do the poll in the evening. All the data is required, or at least at 5 o'clock, the county health departments are all supposed to report in, and then the data gets pushed to us in the morning at 8 o'clock. So it is as of yesterday, of course. That's sort of obvious. Yeah.
Candace is asking, what is the likelihood we will shut down again? Candace, I wish I could see the future, and I wish I could tell everyone. We don't know at this point. We've heard nothing specifically about that at this point. Of course, we know the governor's watching those numbers very closely. I haven't heard anything about the next news conference that we're expecting from him, but one note, Candace, if you or your friends or anybody on here is heading out to San Diego, they have just changed all of their rules for their shutdown. I've posted those over on my Facebook page. There's a simple graph so you can see. I know a lot of people try to escape the Arizona heat and buzz over to San Diego for a bit, maybe just a quick weekend away. The rules have changed quite drastically in the past 24 hours. So you can find that over on my Facebook page, which is facebook.com/news from Katie. So that's where to find that. All right, lots of good questions coming in. So thank you for everybody joining us on here today. Garrett, I'm seeing a few questions about a suspected case. Does that mean it's just they're still working on getting the information that they've tested that person, they just don't know yet? What does suspected mean? Yeah,
that's my understanding as well. That suspected means that there's a person exhibiting all the symptoms. They are they are most definitely hospitalized, and so they are put in sort of a likely category until tests come back. You can actually see this on the summary page, what that number is. So we have, of the 104,572 cases we have right now, 522 are deemed probable at this point. And so you can sort of see, and right here we have this as in the death numbers as well. We have about 120 that are deemed probable COVID-19. So just to sort of have transparency on where this data is coming from.
Yeah. So when you hear those numbers, you'll be able to toggle right over the top of them so you can kind of see where that breakdown is. Deanna asks about the death curve, and that's one of the things, Garrett, I'm seeing all over the internet right now. The difference in what we're seeing across the United States and the numbers across the U.S. are so different from what we're seeing here in Arizona. So a lot of people see a lower instance of height in that curve for the U.S., but it doesn't look the same for us here in Arizona, unfortunately, right now.
No, it does not. I'm bringing it back up for everybody.
Yeah.
So, oh, did I already? I already had it up. Sorry about that.
Yeah, that's okay.
This is the death curve. This is the actual date instead of just reported. So you can see, even though we reported 117 today, all that data was sort of folded into these numbers here. So as far as if it's leveling off or not, we would check the 7-day rolling average, and you can see we're sort of at a peak on the average right now. There's a small dip right there, but that could also be because of the certificate surveillance. So we're going to watch that over the next couple days and see what that 7-day rolling average does.
Deanna says thank you. Yeah, hopefully that explains it. Also, Deanna, on the, let's see, is it on the COVID tracking site, I'm thinking, Garrett, that where she can see the two graphs, the one graph that has a look at the US and then the graph that has a look at Arizona. And I think it's the last one over. Let me pull that up on there too.
Yes. Let me grab that as well. I think I have that sitting around somewhere. So
Deanna, that'll give you a really a quick look at the two graphs next to each other. While you're pulling that up, I want to ask Joshua and Rayanne, who are asking us, what's the website, please? Which website? I want to answer that for you, but I'm not sure which one you need. So
specific, that graph I was just showing you does not exist on the web right now, but where you can find something similar to it, you can find it on the azdhs.gov right now.
Okay, hopefully that answers Josh's question. You're on COVID tracking now.
COVIDtracking.com, and this is daily U.S. deaths.
Yeah. So Deanna, I think that's what you were speaking of. So what you're seeing in the U.S. is you're seeing this curve down, and I'm getting it shared on my Facebook page too. And the important thing to look at is, yes, that is great news for the United States. It is not the same when we look at it for Arizona.
Yes, and I got the name of that paradox. It's the Simpson paradox.
Yes, I said that yesterday, but I wasn't 100% certain that was the name of it. But that is exactly it. Can you recap what that means for people?
Yeah, so the Simpson paradox is when you look at a large sort of group of data and you make a conclusion based off of that data, and sort of try to make a conclusion for another sort of a bin or a portion of that data. And so that's sort of what we're looking at in Arizona. We see this drop in this nice, very nice and very fortunate drop in deaths for COVID-19 for the U.S. But then when we go to Arizona, we're going to see a completely different number. So I'm just going to go that really quick. It'll just take me a second.
And again, for those of you on here, the website's down at the bottom, covidtracking.com, and then pulling up Arizona's graph so you can look at those to compare the U.S. to Arizona.
Yes, and you can see right here, you can see that then this is reported daily deaths, not the one that I'm showing you with the epi curve. This is just the stuff that the AZDHS reports, but you can see that this does not match the curve that we saw with the U.S. Ours is increasing, not by any substantial margin, but it still is increasing. Whereas the U.S. is not. So you can't really draw a conclusion on what's happening in Arizona or another state based off of the U.S. numbers.
Yeah, unfortunately, quite a different story. Garrett, any other things? So we're about running out of time. We've taken up 30 minutes already, and I wanted to. Oh, you know what? Candace has a good suggestion there. Could we work on putting Arizona's map up against U.S. map? At this point, we'd have to crop it, wouldn't we? To put that sort of graph together.
Yeah, I'll see if I can do that. I'll try to see if I can add that to my graphs, just to sort of make that point. So I'll see if I can do that, but that's going to be, I'm not going to be able to do that for another 4 hours or so.
Yeah. Candace, great idea. It just helps people better understand here in Arizona what we're dealing with and how it's such a different situation, and we don't want people to have the wrong information about all of this. All right. Oh, Dorothy says this goes by fast. Thank you, Dorothy. We think so too. Thanks for always joining us on here. it does go by fast. We love helping people find the information and helping people make the best choices about their lives. So that's just what we aim to do, is to show you where this information is so that you can dig in, that you can be better informed with facts, and that you know how to find this. So many other questions coming in. Garrett, a few last thoughts. Is there any other thing that, any other numbers that you saw today that you think we should definitely make note of? I know so many people were concerned about that high number of deaths that came in, and obviously every single number, there is a person behind that, a father, a brother, a sister, a mom, and so we're thinking of those families, and also trying to help everybody understand what all this means. And some of those numbers went back a couple days, but they weren't nearly as far back as some of the numbers that we've seen. So it's better news that it didn't all happen today, but it's rough news that it's just been recently.
The one other thing to watch, and what I noticed today, is that the number of inpatient beds that the state is reporting has increased by over 200. So, and while I'm not 100% sure if that is marking the beginning of them putting beds into service, it is the first. It is not a record. There was at one point a number long ago, a while ago, of 7,900 inpatient beds, but then it kind of dropped to 7,700 and has been stable for several months now, but it's back up to 7,900 today. So we're starting to see that. I'm going to be watching that over the next couple of days to see if that's sort of beds being put into service that were otherwise not put into service, and if that's going to start changing the numbers of hospitalizations, or at least the capacity numbers.
Yeah. All right. Really good stuff. We want to get to more questions, but we're running out of time. Oh, are we on here daily? Such a good question. Yes. Week daily, I should say. Monday through Friday, as long as Garrett and I are both working that day, we try to jump on here and help you answer these questions and try to find the numbers. I mean, I've been covering this since January 17th, when it was just a mystery virus that we literally knew nothing about. And Garrett's been diving into the numbers. He's a numbers guy and has been looking at this forever. So we are happy to jump on here and try to help you find the information you need to keep you and your family safe. So that's all we aim to do. If you have a question or you want us to help you find something, you can find me, as I mentioned, on Facebook at /News from Katie. Post a question there and we'll try to make sure we get it answered in one of these conversations. And you can find Garrett on Twitter. Garrett_Archer is the best places to find us both. Or I'm on Twitter as well, so you can find us in all of these places, and we'll try to get your questions answered. So, all right, that's it for us today, Garrett. Thank you.
Thank you.
And we want to thank everybody for hanging out with us for a few minutes of your day, and we'll see you back here tomorrow.